Whitney. In 2009, the Burlington-based nonprofit housing organization Cathedral Square created SASH, Support and Services at Home. 2 years later, the program became available statewide at no cost to participants. This short video explains the many benefits of SASH.
Healthcare spending is growing at an unsustainable rate, while the health outcomes are, at best, stagnant. The SASH model takes an intuitive approach at improving care and slowing the growth in healthcare spending. SASH is a coordinated partnership of nonprofits including affordable housing, home health, agencies on aging, community mental health centers, and the SASH participant working together to keep each participant healthy and at home longer. This model puts participants and their families in the driver's seat. They set goals around their health with the support of their local SASH team. This collaboration simplifies life by providing transition support from hospital to home, self-management skills for better health, and person-centered care coordination.
And to talk about this nationally recognized program, I'm joined by Liz Genge, SASH Director, and Allison Miley, a Howard Center clinician who works with SASH through a partnership with the Howard Center. Welcome to both of you.
Thank you.
We're very happy to have you. And Liz, it gave us a bit of an overview, that video, of kind of the what you folks offer. But can you tell me a little bit about the wide range of programs that SASH includes?
Absolutely, and thank you for that overview. That was very helpful. But I also wanted to mention that you can sign up for SASH even if you're not living in the 140 scattered sites throughout Vermont of affordable housing. If you are on Medicare, regardless of your income, you can qualify. So we like to say that the participant is in the driver's seat, not the center of SASH, so you choose the level of involvement. Most participants do engage with the wellness nurse to complete the annual wellness assessment. That really helps build a relationship too. So it's a one-on-one time for the participant to meet with the nurse in their home, get to know what's going on with their medications, their chronic conditions. We'll screen for diabetes risks, falls risks, even depression, anxiety, whatever screens that the participant wants to go forward with. And then when we hear more from you, you come up with your own goals, your own plan. So it could be losing a few pounds, could be getting out more, meeting new friends, cutting back on alcohol, whatever's important to you. And then at your request, the SASH coordinator offers one-on-one support. Check in at your apartment, etc., whatever matters to you. It's our specialty to know how to connect you. There's a lot of amazing referrals out there, organizations that we work closely with, so we can really help with that connection. Financial, legal, and of course health. And with your permission, if you want, we'll speak directly with who you find to be in your team. Could be a primary care provider, another case manager, etc. So we coordinate care for people. We'll follow you in your health situations if things are easy, and also when things get tough. So if you find you fall or you're in the hospital, our staff actually get a notification, a ping, so we know that. So we're here for you when you transition back, and to prevent anything to have to go back to the emergency department, for example. We also help with completing advanced directives, bringing nutritious foods to sites around the state. We do Veggie Van Go and etc. We host exercise classes like bone builders, Tai Chi, walk with ease. We provide regular blood pressure clinics. We do things called Know Your Numbers. So we can talk to you, what is cholesterol, what is A1C, what is my blood pressure, how does it all work together, etc. We can be prepared to talk to your doctor if you want us to be that intermediary. We rely on, again, the amazing resources Vermont has, and our staff are also certified trainers in bringing evidence-based programming to the sites. We do things like chronic disease management, and the Tai Chi and Walk with Ease is on the sites. In fact, we aggregate the data that comes from these health screenings, so we know what is the top condition at this community. Maybe it's arthritis, maybe it is hypertension, so we can navigate that and bring what's most useful to the community. And then lastly, I don't want to forget to mention, and I have notes because it's so important to know all of the things that we're doing, that some sites we do coordinate for social interactions. We go out to restaurants using meal tickets from like Age Well and different councils on aging. We also meet up and play pickleball. Some sites are doing things like square dancing, drumming, art classes, so it really varies.
So you guys are doing a whole host of things. Allison, do you mind telling me how the Howard Center is getting involved?
Sure. So just to start off, the Howard Center is Vermont's largest social service organization. We provide mental health, substance use, and developmental services across the lifespan through various programs and services in over 60 locations in 4 counties, serving over 19,000 community members per year. So the Howard Center has been a partner with SASH since SASH began, including attending SASH team meetings and collaborating and coordinating with shared participants. The SASH and Howard Center become an even more close partner since the beginning of the embedded mental health pilot that began in 2017 that Liz and I will be talking more about today, and through the expansion of that program that's been underway for the past year.
So is that program the Emotional Wellness Clinician Program?
Yes.
Is that right? Can you tell me a little about that?
Absolutely. So in 2017, we started a pilot that embedded a mental health clinician who's employed by the designated agency, so in this case the Howard Center, into SASH sites. So really the purpose of this was to bring some mental health resources into the communities that people are living in, to work with the existing team members, so the SASH coordinator and the wellness nurse, to be a part of that team. So we provide individual and group services focused on promoting emotional health and wellness. So that includes individual therapy, couples therapy, less formal or shorter term one-on-one support. That could be assistance with advanced care planning or really whatever their needs are. We also offer group services, including psychoeducation groups and discussion groups on resident-driven topics such as managing depression, emotional wellness, managing grief and loss, interpersonal skills and conflict management, and a lot of other topics that bring residents together to provide a space to talk about these topics and provide peer support and receive peer support. We also work with the SASH team members and other providers such as primary care providers, psychiatric providers, other mental health providers, and help connect people to resources. So an individual might seek out support from the SASH clinician, but they also might want help connecting to other resources in the community, and we can help with that as well.
Great. And how do the emotional wellness clinicians, how do they differ from maybe a mental health counselor or other mental health professionals?
So the major difference is like where the services occur and the types of services offered. So all of our SASH emotional wellness clinicians are qualified mental health professionals. They have a master's degree in a mental health field, and they either are licensed or working towards a clinical license. But we offer services in the home at no charge, and there's a wide range in services. So typically if somebody's seeking mental health support, they're going to be engaged in individual therapy or possibly some case management, but we're really able to kind of meet the needs that they present. So somebody might come in and really just need a couple of visits to work through a new diagnosis they received or grief that they're working through for a recent loss they've experienced. And so we can kind of provide that immediate access, whether it's short-term or long-term. I have individuals I've been working with for 7 years, and some folks that I've maybe met with once or twice throughout the 7 years I've been there. And so really being able to meet those needs with kind of more flexibility than might be found. In addition, because of our funding, we don't charge for any of these services, so that's also a big difference.
And Liz, how has the SASH mental health program been able to expand recently?
Yeah, we are very thrilled that we received some federal grant money. We received 2 congressionally directed spending awards that were endorsed by both of our Vermont senators. So this work is so important and recognized. And with the funds, so far we can expand from the 2 sites to 20 sites over the next 2 years. So the first thing we did was we hired internally at Cathedral Square a mental health program manager, and she is just implementing a program, working with Allison closely, with all the designated agencies around the state to have them look at this model. They're the designated agencies so far that have hired a clinician for SASH is the Northeast Kingdom Human Services, Washington County Mental Health, and a handful more at the Howard Center. And we are looking and working at different stages of hiring in the different areas.
So if you live in a part of the state that maybe doesn't have one, is there any accessibility to get involved with SASH's program for mental wellness?
Well, you can absolutely start by going to SASH, and the SASH coordinators around the state are very aware of this program and how to link into the mental health.
Great. And Allison, do you mind telling us, well, this is a little bit for both of you, but what are the benefits that you've been able to see by having these embedded emotional wellness people working with SASH?
I think we've seen a lot of benefits. We have 7 years of data from beginning from the initial pilot, as well as some information coming in through the past year since we've expanded. So I think one of the most important pieces is the more immediate and expedited and accessible access to emotional health services. So being embedded in people's homes, working with the SASH team, who many people already have a trusting relationship with, means that people can more readily access that level of support. In addition, it's usually pretty quick. So our goal is, once we receive a referral, to contact the participant within 3 days. Often it happens, within 1 day, which is a lot more expedited than kind of our traditional level of care. I've already spoke to sort of the flexibility a little bit, but really being able to meet people where they are in terms of what they're looking for. So some people might be saying, I'm ready for weekly therapy and that's what I'm looking for. And we can talk about, do they want to meet with a SASH clinician or be referred into the community? Again, maybe they experience something, a more immediate or acute event in their life. They're experiencing some distress or grief. And I think that this position and this model can really help with prevention, because say somebody receives a new diagnosis or they're experiencing some level of distress, they might not reach out to engage in therapy, but they're more likely to reach out to somebody who's in their home, who maybe they already have a relationship with, and get that immediate support so that they're not in distress for longer than needed, they're not having more severe symptoms than needed, and they're getting that immediate support when they need it and in the way they need it and in their home. So I think that's a huge benefit.
Great.
We see reduced stigma with this model. So one of the ways we've seen that is a lot of men accessing emotional health services. So in the first about 5 years, from 2018 to 2022, approximately 50% of men at the 2 sites I worked in accessed some type of service. I think in 2022 it might have been 60% of men. So that could be attending one group, or that could have been engaging in weekly therapy. But
I'm sorry to interrupt you. We are
Yeah.
almost out of time. Liz, I really want to quickly ask how people can get engaged if they want. How to get in touch?
How to get in touch with SASH?
Great.
Okay. Visit sashvt.org and click Join SASH, or call us toll-free 833-863-2224.
All right, great. And that website is on your screen at home if you are interested in signing up. Thank you both so much for joining us today.
Thank you.
And that takes care of our program for today. My thanks to the crew behind the scenes here at WCAX. I'm Julie Whitney. Have a good one.